And I can kind of just go through the skeleton of a report to start. So typically we get a clinical history. This is whatever the ordering clinician usually has put in. Clinical history is actually really important because if someone is coming in with a cough for a week versus a cough for 10 months, right? That's going to change my differential diagnosis. I think clinical history is really important to kind of guide the radiologist in helping form an informed opinion of what's going on, that sort of thing. And then usually the next section would be the technique. This is, the type of scan you're getting. Is it a CT scan? Is it an MRI? Are we giving dye or like contrast that we're injecting? Maybe it's done with and without. And then the next section would be comparison. So radiologist's best friend, but hopefully not their only friend, would be comparison scans. Prior scans are so important because if I'm looking at your lungs and I'm finding a nodule, maybe that nodule has been there for 2 years or 3 years or even a year, and that will change my management strategy or my recommendations. If you don't have prior scans, that's okay, but prior scans are always really helpful. And a lot of times we'll ask, you guys to bring in prior reports and that sort of thing. We can always make an addendum and compare. And then typically the next section would be the findings section. This is where the radiologist, goes through everything that they see. And then there's the impression. And this is really the takeaway. So based on what we're seeing, everything we described in the findings section, this is where we form an opinion about what we think is going on. And we give recommendations about next steps.
We hope you liked this video. To support cancer research and get clear expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.